Here we are going to give a focus about the burn. So first of all, a burn is damage to the body tissue caused by heat, chemical, electricity, sunlight, or radiation. So these are the cause of burn, right? So according to the cause of burn, we categorized the burn is this: thermal, electrical, chemical, and radiation. We are coming one by one. So it results in a hypermetabolic state and causing protein and lipid breakdown, which affect wound healing. The client is a calorie intake will need to increase at least 1.5 to 2 times the basal metabolic rate we call BMR. So because of burn injuries, patient lose the protein, lipid breakdown. So we have to increase the calorie intake at least 1.5 to 2 times more than normal basal metabolic rate. So high metabolic rate increase the rate of infection. Why high metabolic rate? Because of burn injuries. First of all, let me focus the type of burn. We categorized three major types. Superficial burn, we called first degree. Second, deep partial thickness. It is second degree burn. And full thickness burn, some books said third degree. So also in different book, categorize the burn like superficial. So superficial burn, it is occur because of damage to epidermis, like sunburn. So causes the slight epidermal damage resulting in redness and pain. So the most outer layer of the skin we called epidermis. So in superficial burn or first degree burn, damage occur in epidermal layer. Best example of superficial burn are sunburn. So red and pink color skin occur and no blister form, but superficial burn is very painful, right? So how you identify the patient have a first degree or second degree or third degree burn injuries? So if we see the skin pink and red only and severe painful, it is first degree burn, and best example are sunburn. The second one or second degree we call deep partial thickness burn or second degree. So some books categorized this one superficial partial thickness and deep partial thickness. They category this deep partial thickness, they categorize two: superficial, deep, and deep partial thickness. Whatever it is, causes the necrosis of epidermal layer and dermal both layer and blister form. but in the superficial one or first degree burn, no blister form. But here, blister formation. Especially the superficial partial thickness burn damage to entire epidermal layer. As like its superficial also occur red and pink color skin, but with blister form. As like a superficial, the superficial partial thickness burn also painful. Now, if I talk about the deep partial thickness burn, more accurately second degree. So patient skin skin is red and whitish, blister form, and swelling occur. Right? And I said the damage occur to epidermal and some part of dermis. Defines the deep partial thickness burn different between superficial or superficial partial thickness burn. It is blister form, and also it is painful as like superficial. The full thickness burn, some books said third degree burn. In third degree burn or full thickness burn, necrosis through all of the skin layer with destruction of the nerve fiber. So in third degree burn, damage of epidermis and dermis, and also part of subcutaneous tissue. And color is varies, and it is sometimes look like dry appearance or leathery appearance. And pain may not be present initially. Okay. And some book agree with you. They said third degree burn, the skin look like black or brown, edema formation, and all layer of the skin damaged or burn. So now full thickness, and another one is called deep full thickness. In deep full thickness, where damage all of the skin layer and extend to the muscle or bones. And the deep full thickness burn is no pain present. Now let me explain what are the different type of burn. One is called thermal burn, like hot objects, frostbite, electrical burn because of electrical current injuries. Chemical burns occur by acid, strong alkaline liquid, or radiation burn like sunburn or external radiation, right? So if I ask you a question like, you also NCLEX would ask, what are the two age group most at the risk for suffering a burn injuries? Answer is children and elderly person. Children and elderly person, right? So imagine a patient face and neck has been burned, what are the nursing priorities? Airway obstruction. So if face and neck has been burned, as a RN, our most priority take care of the airway obstruction, because airway obstruction is most common. We will check the airway first. Okay. So as I told you, in some kind of burn like superficial or superficial partial thickness, blister form. So if blister form, should you burst a blister? Definitely no. It is good keep the blister intact because blister prevent infection. So now go next here, how we assessment the burn. We called the how to measurement, how much percentage get involved in the patient. So we use two formulas, what's called rule of thumb or rule of 9. So here we are going to give a focus rule of 9. What are the most important for NCLEX board here? And also we will talk about what are the nursing management, what are the medication, and what are the surgical treatment as well. So rule of 9, this method divided the total body surface area into the segment that are multiplied by 9%. So here in this picture, you can see the rule of 9. Head and neck area, we count 9%, entire head and neck. So if the patient face has been burned, it is 9% burn. Okay. If the patient has posterior occipital area burn, is also 9%. So if the anterior part of the body, we call front part or torso, it is 18%. The posterior part of the body or back side, 18%. Upper extremities or upper left arm, 9%. Upper right arm, 9%. The perineum is 1%. The left lower extremity, 18%. Lower left extremity, 18%. So, example, if I say left lower extremity anterior, 9%. Left lower extremity posterior, 9%. And entire left leg anterior and posterior is 18%. 9 multiplied to 18, rule of 9. So if I say both leg anterior and posterior has been burned, means 18 plus 18 or 18 multiplied by 2, 36%. So like left arm and right arm, both anterior and posterior has been burned, means 9 and 9, 18% involved. And whole anterior part of the patient chest, abdomen, anterior involvement, 18, posterior back, 18, and anterior and posterior both together 36%. What about the difference? Compare, contrast the children. The children maximum body surface area in their head and neck areas. Whereas the adult person 9%, but in case of children, head and neck, entire head and neck, anterior posterior 18%. But in case of adult 9%. Rest of it is same except at lower extremities. In case of adult, it is 18%. In case of children, it is 13.5%. Perineum is 1%, both cases. Upper extremity left 9%, right 9%. Whole together 18%. Torso or anterior part of the body 18, posterior part of the body is 19%. Now we are going to focus what are the target or goal of care for a burn patient. The most priority is maintain the patient airway. So when a patient came to you, or if we give a care for a patient who are victim, what is the first priority? Our first priority should be stop the burning process. Also, flush the chemical burn with a large volume of water. Then educate the family to not apply any greasy lotion or butter to the burn, because some people non-educated, they do this. So we educate the patient not to do this in future. And also clean the area with a mild soap or plain water, right? But when patient came in the hospital, our first priority, check the airway. If any obstruction or aspiration, we have to clean it first. May require intubation and supply oxygen. So administer the colloid or plasma expander as prescribed, but oxygen is most important, right? So now they said prevent or correct the hypovolemic shock. So the patient who undergo or has been burned, they have a chance to lose the fluid. Because of loss the fluid, blood pressure go down and lead to hypovolemic shock. So total blood volume go down. So we call a hypovolemia and shock develop. So we have to monitor the sign and symptom of shock. Okay. First of all, monitor the vital sign, like increase the heart rate due to decrease the cardiac output, decrease the blood pressure, hypotension due to increased permeabilities. What else? Also, decrease the urine output. Patient will be confused. Fever or chill, decrease the bowel sound, And we said increase the capillary permeability and also increase the capillary refill time. Patient has a tachycardia, means increase the heart rate, increase the respiratory rate, we call tachypnea, right? So insert the large bore angiocath. IV fluid replacement is most important. It can save the patient life. So if NCLEX board asks, what are the best route for pain medication or IV solution, we said IV line. So IV fluid management is most important, right? So what are the fluid we give to your patient? Hmm? So we give them 0.9% sodium chloride or lactate ringer or ringer lactate, whatever you call, right? So let me tell you and recap something. So give, first of all, check the airway, give them oxygen, right? So during the maintain and check the airway, we sign the eyebrow, nasal hair, and also sputum are indicate of inhale the damage. We administer humidify oxygen as water and also insert the large bore needle for fluid resuscitation. Sometimes NCLEX board, what fluid is good for the patient? Our answer is the 0.9% sodium chloride or lactate ringer or ringer lactate, shortly called RLR. So what are the formula we use to determine fluid replacement for the first 24 hours? The formula is called Parkland formula. So Parkland formula for the fluid replacement and give half of the total volumes in first 8 hours and second half of the fluid next 16 hours. We have to follow these rules. The Parkland formula said, or Parkland formula equal to 4 ml of Ringer lactate or lactate Ringer solution multiply body weight. So if your patient body weight is 75 kg, then multiply 4 ml of lactate Ringer multiply body surface area. How much body surface area gets involved in burn? How we calculate it? By rule of 9, what we discussed few minutes ago. So admin the blood and blood product is prescribed. So if we need, we give them to save the life. Also strictly monitoring input and output chart, daily body weight, and also enrolling catheter. The correct metabolic diagnosis like IV fluid and sodium bicarbonate. So the patient who has been burned, they have a chance to develop electrolyte imbalance, especially metabolic acidosis. how we collect it by IV fluid and by sodium bicarbonate. So infection is most common the patient who undergo to the burn. So it is good to admin tetanus vaccine. Okay, we call tetanus toxoid. Let me recap it. How to prevent the infection? Give them tetanus injection as a prophylactic and cover the wound with a sterile or clean dressing and sterile dressing change. Give them antibiotic and protective isolation, right? So what other medication we use? Sometimes we give them silver sulfadiazine or bacitracin ointment. We are coming up there. But first of all, another question sometimes NCLEX would ask about the nutritional status. What food we give them. So what are the best diet is appropriate for burn patient? High calorie and high protein. You see, high calorie, high protein is good. Also, some patients need total parental nutrition. We could count the calorie and import and output chart. It is important for NCLEX board. So what else? So if the patient restored the skin integrity or means skin grafting, what we should do? So skin grafting and as a RN, nursing care is so important. So if patient undergo the skin grafting, we immobilize the graft site, elevate the extremities and monitor for sign of infection. So how we prevent the infection? Okay, it is we have to know. We can prevent the infection by no fresh plants or flower, limit the visitor and use the patient designated equipment only and definitely dressing. Also, we should prevent the contracture. How we can prevent the contracture? Just give them some exercise. Range of motion exercise is a part of activities. Proper positioning important and maintain the proper alignment. And prevent other complication. Curling ulcer. So due to the prolonged stress, the client are at the risk of type of ulcer develop, and this ulcer is called curling ulcer or stress ulcer associated with severe burn. What are the treatment? H2 blocker or proton pump inhibitor like omeprazole. So proton pump inhibitor or H2 blocker like ranitidine. Next, restore the function as much as possible, like rehab, occupational therapy, physical therapy, and also speech therapy. Interdisciplinary approach re-established the social and emotional equilibrium. The burn from the wrist up or airway is the first priority, From the waist down, the fluid and electrolyte management is the most priorities, right? So let me recap something. So when a patient has been burned, my first priority, remove him from the source, admit some colloid or plasma expander, monitor the sign and symptom of the shock, prevention the infection, provide the nutritional support like increase the calorie and protein intake, also prevent the patient mobilities, preserve the patient mobilities like active and passive range of motion exercise to prevent contracture, apply the patient dressing as ordered. Now go medication. We give them pain medication first, like opioid. So morphine sulfate to control the pain or non-steroidal anti-inflammatory, sometimes useful. So admin IV opioid analgesic. Also, we should avoid intramuscular or subcutaneous injection. Let me recap it. I said administer IV opioid analgesic for pain management, and we must avoid intramuscular or subcutaneous injection. Important. And then what else? Silver sulfur diazine. So this is the antimicrobial and does not penetrate the deep layer of the skin and but may causes the transient neutropenia. It is temporary. And also we can give mafenide acetate. Mafenide acetate. It is antimicrobial and it is can cause metabolic acidosis. And sometimes we use the antibacterial ointment, bacitracin. They prevent the secondary infection. So what sometimes NCLEX would ask, what medication should be given before changing the dressing? Pain medication. Okay. And what are the most common electrolyte problem in the client with burn? Patient develop hypokalemia or hyperkalemia. And both can seen in the client with burn. Hypokalemia or hyperkalemia both can lead to cardiac dysarrhythmia, right? It is more than enough for one patient for NCLEX board exam.